on Hallmark Channel, the heart of TV.
From Universal Studios Hollywood, welcome to Home and Family.
Brighten up your day, go home and family way.
Hello, everybody, and welcome to Home and Family. It's Friday, and we have a great show for you. No.
Would you feel better if I spoke like this?
Yes, I'm glad you're here, and I'm glad we're surrounded by our beautiful family members and our guests today, and we have a great show for you.
Surgeon and liposuction specialist Dr. David Amron is here to shed new light on a debilitating condition known as lipedema. Dr. Amron, what is lipedema?
Well, lipedema is a chronic, debilitating fat storage condition that affects 17 million American women, 370 million worldwide. Most people have never even heard of it. Most doctors, I gotta tell you, have never even heard of it. And it presents as swelling and fat in the legs primarily, and then many times the arms too. But it's the fat, the lipo part, and the edema, the swelling. And it becomes painful many times later on.
And you have actually brought one of your patients here with you today.
Yes, I did.
And it's an amazing transformation.
It really
you will
is.
not believe this.
Yes, this truly is.
It is really amazing. Right, next, we're going to sit down with dermatological surgeon Dr. Amron and his patient Yasna to learn a little bit more about the disorder lipedema.
Welcome back. You know, little is known about lipedema. It's a debilitating fat storage condition that affects 11% of women worldwide and 17 million nationally. Now, Dr. David Amron had been performing cosmetic liposuction surgeries when he perfected a technique that successfully treats this condition. And joining Dr. Amron is his patient, Yasna Tursik. Well, welcome. Nice to have you both here, and thank you for sharing your story with us today. What are the characteristics of lipedema, and why is it different from the regular fat accumulation that you have on your body?
Yeah, so with lipedema, there's a lot of disproportion, and it usually shows up as disproportion in the legs, the calves and ankles, the thighs, kind of all the way around, like you'll see in Yasna's case, many times the arms. But there's not only just the fat.
We're looking at this as before, right? And
Yeah, this is before.
What are we looking at here, doctor?
Well, you can see there's a lot of fullness in her legs all the way down. And the patients have this column-like, almost tree-like look to their legs, where they're fat circumferentially, along with their knees and their calves also. But there's not only just fat there is a lot of edema. So it's the lipo part of the fat and the edema to the swelling.
What is edema?
Edema is swelling, yeah, so swelling the tissues. It's different than lymphedema, which is just pure swelling the tissues due to a lymphatic problem primarily.
So let's hear a little bit about your story, Yasna. You were misdiagnosed for 10 years. Was there any advice or any treatment out there for you? What were people saying to you?
I was misdiagnosed for more than a decade with lymphoedema. I had 5 vein not necessary surgery.
You had 5 vein surgeries?
And they were all unnecessary?
Yes, because I never had lymphoedema, I had lipoedema. Finally, after I think about 12 years, I was diagnosed with lipoedema. And in time when I was diagnosed, it was very bad. I was in late stage 2, and my mobility was impaired. And doctor, they didn't know, they didn't have solution for me. They told me I had to go to pain clinic,
and that you would
apply for disability, and
that you would eventually end up in a wheelchair.
yes, that's what I was told.
So what happened the day that the doctor diagnosed you with this particular affliction? What did you do? What did he say? Where did he send you?
Doctor who diagnosed me sent me who's only one specialist in the country, and she diagnosed me in late stage 2. And she gave me a list what I supposed to try, all supplements, some brushing, MLD therapies, manual lymphatic drainage, and I tried everything.
Well, how did you get to Dr. Amron?
After nothing helped, my last solution was type of liposuction. And I found Dr. Amron online.
And Dr. Amron, what was the specific procedure that you actually did on Yasna to cure her? And how is it different than regular liposuction?
Yeah, so good question. I've done liposuction for 20 years. I specialize in this condition, or excuse me, specialize in liposuction. And it is liposuction, which is really a much harder procedure than people think. It's so much more than just sucking fat out. It's a very precise procedure. But this is very difficult surgery. This is very complicated surgery where you're doing areas that most surgeons want to avoid, which is the calves and ankles, the anterior thighs. So in Yasna's case, I did circumferentially all the way around in 2 different procedures on 2 different days, 2 hours each. But it's very precise liposuction. I do it under local anesthesia, which I feel is much safer and cleaner, and it's also lymphatic sparing. You're not damaging the deeper lymphatics with it. You are only staying purely in that layer of fat, because in this condition, you do not want to damage the deeper lymphatics.
So it's almost a bit like sculpting.
Well, it's absolutely sculpting. Even, all liposuction really is sculpting. Yeah.
So let's take a look at the legs after the surgery. What we had before, and now we're going to see the after and the difference.
Wow.
That is amazing.
Wow.
That is just, it's...
And how long before, what's the recovery time on something like that?
Yeah, so I did 2 procedures again, like in 2 days, 2 hours each. This was taken several months later. And it really, I got to say, it's a dramatic improvement. And to get these type of results, it really is dramatic.
And this
all
is
the way.
you, Yasna.
And this is me. Yeah.
Is this going to come back?
No, the beauty is, liposuction is really the only cure for this condition. You really are permanently removing that fat tissue there that has proliferated. And then along with that fat tissue, she's got the swelling that goes along with it. So she's getting this double-fold improvement, not only just the fat all the way around circumferentially, but the edema that goes along with it.
Why aren't more doctors aware of this?
Yeah.
That's a great question. Most doctors don't know of it, haven't heard of it. And I got to be honest with you, up until a few years ago, I wasn't really aware of that specific condition, because I look back at my 20 years of doing this surgery, liposuction, I realize I've had a lot of patients who've had lipedema over the years, either mild or more moderate forms of it.
Well, what advice would you give to somebody who is suffering from lipedema now? They may not know they're suffering from lipedema.
Well, yeah, I think the first thing is, get properly diagnosed, you have this specific condition of lipedema, see somebody who has a lot of experience in it, a specialist in it, and then really the proper cure is to find the right surgeon to specifically go about doing the contouring surgery. But it's not easy surgery, I gotta tell you, it's very specific surgery.
This is really fascinating. This is something that I would like to do a lot more research on. There's a lot to
Absolutely.
delve into.
There's a lot we're starting to understand more and more about this condition.
Yasna, how are you feeling now?
I'm feeling great.
And I understand it's a very expensive procedure as well. So the things that you went through before really was put a strain on you financially as well.
Yes, insurance doesn't cover, and actually I spent...
Oh, look at that.
Look at the difference.
Wow.
I spent...
Like a new woman. It's a new woman. Look at you.
She lost some weight, I gotta say, but really most of it, probably 80% is the liposuction that made that improvement. And then she was on to exercising and losing more weight because she had so much disproportion and the pain and the immobility. And once that was corrected very quickly in 2 surgeries, she's then off and running with things.
How has your confidence level been?
Great. Better than ever. And thanks to Dr. Amron. I saw probably 20 plastic surgeons before Dr. Amron, and nobody wouldn't perform any surgery. I was told that they don't want to touch me. And Dr. Amron really was my last hope, and he gave me my life back.
Well, I bet you love wearing a bathing suit now, huh?
Yes, I do.
Oh, wow.
Just in time for summer.
Okay. If you'd like more information, or if you think you may be suffering from lipedema, you can visit amronmd.com. And you can also get support at Lipedema Sisters USA on Facebook. And we want to thank you, Dr. Amron and Yasna, for coming on and sharing.
Thank you so much.
That's right. Come on down and see us. Dr. Amron, do you have any suggestions on how we can find the proper liposuction per doctor?
Well, just in general, placing your trust and caring in a doctor, especially a surgeon's hands, is incredibly important. And, the world has changed. Medicine's changed, and there's a lot more selling going on, especially in cosmetic stuff. So I would say that, pay attention, be smart, pay attention, especially consultation. And ask yourself, are you feeling truly guided and cared for, or are you feeling sold to in the consultation? If you're feeling sold to, that's a red flag.
And I'd just like to say it's hard to believe, we talked about this in the segment, that 17 million women suffer from this. Why do you think that is?
I think it's just an under-recognized condition. It's as I think back to my 20 years of doing this surgery, that there's a lot more patients I've seen over the years have had lipedema, even in milder cases that I've treated and cured.
Well, you certainly shed a lot of light on it today, doctor. So
I'm
thank
very
you
happy
so
to do
much
that.
for sharing.
And you're
your story.
changing people's lives.
I
for real.
want people to become more aware of this condition.
Thank you.